Hello, I'm Robert, a fact checker and science blogger. Welcome to my channel where I help you, people who are scared of various things. So this is about what's happening in the United States, and it's looking really good now. I mean, of course it's very sad that you can see the deaths are still going up, but look at the cases per day, and they're falling faster than they have ever done. They've never fallen as fast as this. So obviously, the United States is doing something right. And then, if you look at all the states, then every single state has rapidly their cases going down. All of them are going down. There isn't a single state at the moment with cases going up. We can, if we have a look at the infection rate, this helps us see what's going on. So now let's look at the states. So the highest infection rate is 0.97 for Virginia. This means that if you have 100 people infected, then they on average will infect 97, and those will infect a smaller number again, and those will infect a smaller number again. Until recently, that was just a couple of days ago, 3 days ago I think, the highest number there was 1.01, which meant that if you had 100 people, then infect 101, infect 102-ish, 103 and so on, it would keep on going up. So it's either going up or down. The 1 there is the difference. And if you go back a few weeks, then you got figures there like the highest one was like 1.2, 1.3 even. Now, it's not the entire, all the states are showing big differences, but if you look at the counties, then the highest infection rate is nearly 2 in the worst case, but the lowest infection rate is 0.3. So that means 100 people will infect 30, which will infect 10, which will infect 3, which will infect 1, and then it's gone. So you can see when you had a big outbreak of 100 in that particular county, then it would soon be over. So if we could get all the counties to get an infection rate down as low as 0.3, then the whole thing would be over very quickly. So this is really where we want to aim for. Now, this is feasible. You can reach that because New Zealand, of the entire New Zealand, when they were dealing with their one, they got now about 0.4 of the whole of New Zealand, and that led them to come down very rapidly. We can see this picture down here. Where are we? Yeah. That's how they went from 60 confirmed cases on the 1st of April to 2 confirmed cases on the 26th of April. So very fast reduction. And Wuhan in China, they had a reduction about that speed, and in South Korea during their first peak, they got a reduction about that speed. So, and then you worry about the new variants. Well, we're getting very fast reductions from the new variants. And the United Kingdom, it's going down quite fast. It's halved more or less since then. The cases per day, the deaths are lagging and the hospitals are lagging, and that's with the new variant. So, and that is with us still being quite sloppy still. You know, we're not doing brilliantly in keeping the public health measures, especially we're doing very little by way of test, trace, isolate, quarantine, which is the key to bring it down very fast. And Biden in the United States is going to be doing that. So I think it looks very, very promising. The reason it went up here, all that period of going up and up, so it went down, and then United Kingdom was very striking. It went down almost to 0 in the summer, and then it started going up and up and up. And the reason was people letting up and not taking the right precautions when it got way down. When you get way down, you should step up on everything. Now, I'm very glad to hear the United States is going to do that. They're going to increase the measures they're going to make sure that the R0 keeps going down. So I was talking about the R0 just now. And let's go back to the States. And Tennessee is an R0 of 0.75. And remember, it can be much better than that. So if we go and look at, that's Tennessee. Now look how quickly it's going down. So if you get 0.75, it can go down very fast. If you could get 0.4, it would be down there by now already. So this R0 is the key. Now the key is, once you get very low, when you get very low numbers, if you get an R0 0.4, they should be gone down there. If they can manage to do that and keep going, then once you got down just a few cases per million, keep going. As long as the R0 is less than 1, then 100 people will infect 40, will infect, remember with 130, 10, 3, 1, gone. So once you're getting to 100 per day, then you're getting very close if you can manage an R0 of 0.4 even. So, and then once you've got down to just a very few cases per day, if your R0 is less than 1, it's got nowhere to go. Eventually, you'll eliminate it. And that is something that the United Kingdom could do too. We just didn't do it over the summer. When we got to those low numbers, we let up. And the reason is because in the United Kingdom, we didn't follow the science. So we politicized the science. And it's the same with Trump. He politicized the science. And that's why it kept going up and up and up. If he had followed the science, it would have gone down and down and down. And with easing up, and if you follow the science properly, you can ease up the measures more and more and more. If people had kept wearing masks and kept doing physical distancing, and if he'd given a lead from the top, as Biden is doing, it would have gone down and down and down. By election day, there would have been hardly any cases left. He would certainly have been re-elected if he'd done that. But he didn't. And the reason is nothing to do with being right-wing or left-wing. Because I think that Maggie Thatcher, for instance, the most right-wing in the United Kingdom, one of our most right-wing prime ministers in recent times, but she was a scientist. And she was first to talk on the world stage about the climate change. And that was 3 decades ago. She brought the attention to the world stage that we really have to do something very urgently on climate change. The first person to do it, very right-wing in United Kingdom politics. So that is because she was a scientist. And respecting science is the key to many of the challenges in our modern world, like climate change and like COVID-19. And that's why this is going down, due to respect of science. And if we'd done that back here, it would have never gone up. It would have been gone already. Back then, it would have been to 0 cases already if we had done what we're doing now back then. Because it's the same equation. If you can get your R0 less than 1, and if you've got 1,000 cases in the entire country, then soon you'll have none. And so we could have done that back then, and the United States would never have had an outbreak. And that's not just imagining things, that's not just thought exercise. Taiwan did that. And it's not just most provinces of China, then they never got an outbreak. And they just had a few hundred or even less than 100. And so most provinces of China, which are the size of entire European countries, Taiwan did the same, which shows you don't have to be authoritarian. And then New Zealand did the same with a delay. So if New Zealand had put things into place right away, right at the very beginning, at its very first case of community spread, if it had been as rigorous back then it would never even have gone up as high as it did, which wasn't very high. So it went up to about 80 cases a day for the whole of New Zealand. But if it had been more prompt, like Taiwan was, it would never even got that high. So it's all about following the science. Now, I just want to say very quickly that it's not about following scientists. That's where many of the leaders have gone wrong. So you don't take your favourite scientist who says what you want to hear and follow them. There's a method called a systematic review in science, and that involves being open and listening to all the science and doing checking, evaluating the science by how vigorous the studies are and by the scientific method, not by the results. And the United Kingdom hasn't really done that. It's taken particular groups of scientists and said, we like what they'd say. And then the other groups of science challenge them and say, what is your reason for your decisions? And then politicians come in and say, I don't believe either of you, we can go much easier than even the group of scientists that have been telling us that we don't need to be quite as strict as these other people say we should be. And that's why we've had them increasing like that in the United Kingdom. And but you need to, what the US CDC is doing it properly. If only we did it the same way in the United Kingdom. They do a systematic, careful review of all the science rather properly. And then the World Health Organization, they do that too. And to some extent we're doing it in the United Kingdom, but not really properly. More so now. We really at the beginning in March we weren't doing it very well at all. It was all secret decisions by the SAGE group, and nobody knew why they made these mysterious decisions that they told us all to do. More secretive than China by far. Anyway, I don't want to go on and on about that. I just want to keep this short. So my main point is that the United Kingdom has not been following the science very well, but the United States hasn't been following it well at all. But we've now at last got a president in the United States who is following the science, and this is why I'm very optimistic. Nothing to do with his politics. He could have been a right-wing politician and have a right-wing way of tackling the problem. There are many different political ways of tackling this, but the main thing is to follow the science. And we've got a leader in the United States who is following the science. That's why I'm very optimistic, because they are so influential. Now, so reasons to be optimistic. We can, first of all, we can vaccinate everyone in 2020, 2021. And this is really the wonderfully effective vaccines. And we can reduce the deaths and the intensive care hugely by the end of 2021, especially by the summer, probably. We've got vastly expanding capacity. By the 2021, we can expect to make 30 billion doses a year. But that's 4 times the world population, or double the world population if there's 2 doses per vaccine. And that's just on what we've got already. We'll be developing more. And we can vaccinate more than the world population in 2021. And we've already pre-ordered more than half the world's population worth of vaccines for 2021. So, and then we've got the wonderful COVAX alliance. And it's just something to be so optimistic and so positive about. And so I talked a bit negatively about how people are not following the science. But the positive thing is that we're learning so much. And it's really, you can't, in a way, it's being a bit harsh on people, these politicians like Trump and Donald Trump and Boris Johnson, because part of it is that we haven't had to face a pandemic before. And in China, they had faced not a respiratory disease one of this level of severity, like SARS, and one that can be stopped with test, trace, isolate, like SARS. And that is why China got so fast off the mark. And it's not because they're authoritarian, it's not because of their politics, because with SARS originally in 2002 to 3, China was very, very lax about it. And if they'd had COVID in 20 years ago, then it would have been appalling. It would have been all over the world before China told anyone. So we were very lucky that SARS came first and COVID came second. So when we say how wonderful the Chinese response was, and it is the response of the epidemiologists and the doctors and the nurses from past experience of SARS. It's not because of their politics. That's not a significant factor, I don't think. And I think that we are now prepared in the United States and United Kingdom to some extent. We are learning gradually, very painfully, that you have to follow the science and how to stop a disease like this. And so that's where we should have learned from China. But we were rather prejudiced because we said, oh, they're an authoritarian, we can't do what they're doing. So we didn't learn as much as we could have. But it's doctors, nurses and epidemiologists that we could have learned from in China. It's not learning from their method of doing politics. We could have learned their medicine from them and their very prompt and very excellent medical response to COVID-19, which we have not yet duplicated. In February, China was able to achieve a turnaround time of 4 hours for PCR tests. And they immediately isolated you. So if you and they also educated the public, they gave very clear public education, which is, again, you don't need to be authoritarian to talk in a clear way to the public. Jacinda Ardern did that in New Zealand. Joe Biden is doing that in the United States, speaking heart to heart, and not just that, not getting in the way of the scientists, letting the scientists, the systematic review scientists, not the eccentric Barrington Declaration scientists, but the ones who do it properly. And they're not presenting their own eccentric ideas. They're presenting what the systematic reviewers, the best understanding of science to following the method. So we get them explaining everything to the people, and then the people following it. So in China, they explained this clearly to the people. People understood the importance of getting tested, and they explained the symptoms very clearly, and they got the time from first onset of symptoms to getting your test result down to 2 days. So if you have a first onset of symptoms, then within a day or so you recognize this is possibly COVID. You go and get tested. They didn't let you go back home after you got tested. You went and said, I'm feeling a bit rough and it feels like COVID and I've got a cough or whatever it is. And then they said, okay, we'll test, get your throat swab. They would take it off the PCR machine and immediately do the testing. And if you've got technicians on hand, plenty of machines, trained people, you can turn around a PCR test in 4 hours. They got their average to 4 hours for the amount of time it took in February, when they got thousands of cases to do a day, to get your test result. And then once, if you tested positive, you were immediately isolated, no matter how mild your symptoms were. And so we would not say you've got to get tested. We would say it something like this in the United Kingdom. We would say, look, we've got free hotel accommodation, all your food that you want. You give you just normal food, not fancy food, but just decent food. And we'll look after all your needs. We will check you every day for COVID symptoms and get you immediately to hospital if you need help. We offer this to you. If you don't, or the alternative is that you go back and stay with your household. Be aware that if you isolate with your household, it'll double your risk or more, whatever the ratio is to the other people in your household. And you've got a greater chance of your granny dying if you do that. So which of these do you want to do? And I think most people would go for the hotel. I certainly would. I'd jump at it. So, and especially as we get down to a few cases per year, per million, then we should definitely do this. And I personally think that we could actually, part of the stimulus, if you get the funding for it, then you could just pay for hotel staff and open up all the hotels that are currently closed, train the hotel staff to look after COVID patients, and then not in the way a doctor or nurse does, but just the ordinary PPE like care home residents, or for instance, people looking after in care homes, just knowing how to do PPE properly, or whatever it is, the proper precautions to leave the food outside the door and everything. Then that would keep our hospitality industry going. Not only that, it would save money, because intensive care units are extremely expensive. And this would, isolating cases quickly, would quickly reduce the number of intensive care cases. And so you'd be saving all the money, and not only that, the stress and the wear out of the people looking after the intensive care units. And of course, lots of very sick people and lots of deaths. And so, I mean, it doesn't make sense not to do it, in my view. Not to do supported isolation of everyone who's got COVID. I think even no matter how many you've got, it makes more sense to do that than to have them at home and have a certain percentage getting very sick and a certain percentage dying. It doesn't make sense in my view. Anyway, we'll see what happens. But I'm just so oh yes, no, I haven't explained about the COVID. So, and that's not just me. The former head of the US CDC said that isolating and quarantine should be a VIP experience. So he didn't quite. So that's basically what I'm saying here. So hopefully that's what's going to happen in the United States. We haven't got all the details yet. And then I'm just going to explain about this. Did I explain about that? That if you've got the 0.75, now even if the vaccines, I'll talk about it in a separate video, but the vaccines have a decent chance. I think it's pretty certain that we'll get half the transmissibility with the vaccine. If you look, that AstraZeneca already achieved that with one of their protocols, and that can't be the best. But I've got that also, if you've got asymptomatic, then your risk of giving, if I'm in the same house as someone who's got asymptomatic COVID-19, the chance of me getting it is less than 1 in 100, it's 0.7%. If they've got symptoms, it's 18%. So there's a huge difference between your risk if you've got symptoms or you've not got symptoms of risk of transmission. Now, the 56% reduction of AstraZeneca is reduction in all cases, including asymptomatic. So if you also take account of asymptomatic people after being vaccinated being much less infectious, then it's probably not far off the 90% that you get if you from reducing the reduction of symptoms. So I think it's really quite promising that these vaccines maybe turn out. It's too soon to know. We need a few more weeks of research. But I think it's very promising that vaccines may be very effective in stopping transmission too. If so, this will make it much easier to stop this disease. Anyway, we need to keep on doing everything. Things are looking really good in the United States, and if we do succeed, then this can be the first that we can stop this. I see no reason myself why we can't get rid of this completely in 2021 or 2022, eradicate it. Now, if you'd gone back and told the people, told the World Health Organization or anyone else in 2019 that in 2021 we will be considering eradicating a disease from the entire world in 1 year, or that we would develop a vaccine in just less than 1 year, they wouldn't believe you. It's just absolutely incredible what we've done and what we can do, and with the COVAX Alliance, I think we're going to do extraordinary things. We already have done extraordinary things. The way we've managed to work together, the way that we've supported even the poorer countries as well, and the ones with weaker economies, we've stopped them from going under. We've prevented a Great Depression. We've we supported all the, and it's just incredible what we've managed to do with what we've done. And then we're going to be rebuilding back with a much better, stronger healthcare system, and with renewables and the work on biodiversity and everything. We're coming together in just amazing ways that you would never have believed, even a few years ago, that the world could do such a thing. So I am very, very positive. I think we've got just amazing what we are managing to do. I know it's absolutely dire, and it's so sad what's happening to so many people, but you can continue to protect yourself. So just do everything to protect yourself, continue to protect yourself, and you can do the physical distancing, the hand hygiene, you can do your own contact tracing. I've talked about that before, because you can find your own contacts, people that you have been in close contact with, and keep doing everything. Do the quarantine properly. No, I didn't mean to bring that up. Quarantine, isolate, and then governments, they are at last coming behind all this as well. And I really do, so do check out those 10 ways. I'm going to do a thing about that as well. No, I've already done a thing about that. And so I don't think this isn't a blip. They're definitely coming down very fast, and they can come down much faster. And I think that we've got a few more weeks to months of this still, but I think that we're going to end this much faster than people think. If because of the leadership from in the United States, because they're doing it properly. It's not, people are still thinking in terms of we've got to vaccinate and only the vaccine will stop it. But we can stop it without a vaccine. And don't worry about the new variants, because as I said, then did I mention this bit? Look how quickly they're reducing the cases even with the new variants. So we can still do it even with new variants, and that's without the vaccine. And then remember, the vaccine will probably halve, and maybe more than halve, the transmissibility, so it come down even faster. We can bring it down, and remember that half, if we got it even naturally at 1, and this is obviously less than 1, and then we add, and with the variants they're doing it less than 1, and then if we add the vaccine on top of that, then it's much less than 0.5, and 0.5 for New Zealand's example is at least a 10-fold, 20-fold reduction in just 25 days in cases per day. Same with Wuhan, same with South Korea. So long as we keep it up and follow the science, and we follow science properly this time, and we keep following the science, and we use the vaccines as well, then I think we're going to be over this sooner than people expect. That we're going to be down to cases per million, and then the thing is to keep going. Once we're down to cases per million, in New Zealand, when they got down to cases per million, they kept up with once you've got only a few cases, even if you only got 10 cases in your country, really put everything at it to make sure that you find all their contacts and that they're all isolated. Then you have no cases. Within a few, or if they've got a few that manage to escape, find those very quickly, test everyone with flu-like symptoms throughout your entire country, test, and then isolate, quarantine. Keep it up, and then keep up with the physical distance and mask wearing until it's gone, and then we can be back like that. And I don't see, they talk on and on in the United Kingdom on television about this is going to have to be, we're just going to have to resign to this being endemic, and because of all the new variants, and we're not going to be able to stop all the new variants, and it's going to become endemic. There's no need for it to become endemic. We can stop the new variants too, and there's no way that New Zealand is going to let it in. I can't see, it just doesn't make sense that New Zealand or China would open up their borders to the disease even with them all vaccinated. Why would you do that? It makes no sense. So I see a future where even if the vaccine makes it no much worse than flu, why let flu into your country if you can keep it out? Makes no sense. So I see that New Zealand and China and the other countries that have got rid of it, I see them keeping rid of it and not letting it in. I can't see them letting it in deliberately. And then it's up to the rest of the world, and there's no way it's going to come in so long as they continue with their quarantine and isolation and very quickly dealing with anything that arises. And then the rest of the world, I think, country by country, and perhaps even United States, state by state, some states in the United States may be virus-free after, before the summer even, if they do this, or sometime in the summer of 2021, if they are as rigorous as this as they could be, if they really follow these things carefully. And so continue to do everything yourself. Just keep it, we've got to keep it up. I know people get so tired, but just make it automatic. Don't stop and think and wonder. Always step back. Whenever you possibly can, work mask or no mask, inside or out, step back. The World Health Organization say physical distancing is the most important thing that we need to do. It's more important even than a mask. And hand hygiene and everything else, but above all, do the physical distancing, do the isolating, do the quarantine, and tell your contacts if you get COVID, and advise them to do all this isolating and quarantine. And we can be over this, and we can be over this much faster the more that everyone does it all. So just keep at this together, and we've got these wonderful vaccines, and they'll make a huge difference. And the vaccines do work against the variants. They may become less effective against some of the variants. We just had the news that, which one was it? I think it was it Novavax? One of the two vaccines that was released today works against, I'm pretty sure it was the Novavax one, yes, that was 90% effective against the Oxford, the United Kingdom variant, but it wasn't quite so effective against the South Africa variant. But still, it's way more than 50% effective. But the good news was that they are already working on ways to swap the spike, and the World Health Organization is talking about that right now, or pretty soon, in the next few days. They are having working meetings on how to regulate the spike swapping, which is to say taking an existing vaccine and maybe for your second dose, for instance, you might vaccinate with the different spike, so that, and they could regulate that with enough, try to get fast regulation for a few weeks, or you could get a booster shot that helps you if you get a new variant spreading in your country that is not being that there's a reduction in the effectiveness of your vaccine because of the change of spike. Then they should be able to do it much faster than for flu, and they're still working out the regulatory framework, but they are looking at the matter of being able to change the spike in weeks of doing the effective testing. So that's what we're hoping for. So it's still very important to keep doing everything, but just to say that the situation is really good. It's just our science is just extraordinary. What we can do with our science, and really we just got to follow the science, and we can get rid of this thing much faster than New Zealand got rid of it much faster than they expected once they start as a result of following the science. And I expect that in the United States, because at last they're beginning to follow the science. Nothing to do with politics, just to do with science.